It's that time of the week, Tuesday morning, just after 7:20, when we have a live conversation with Dr. Isaac Bogoch, infectious diseases specialist at Toronto General Hospital. Always good to see you, Dr. Bogoch. And I wanted to start this week talking about whooping cough. You know, we've seen outbreaks in a couple of different provinces here, but the biggest outbreak right now appears to be in the UK. And there is a vaccine for this. So what does the situation tell you about what's happening? And are we here in Ontario immune from this?
Yeah, it's very problematic. This is a terrible cough, a vaccine-preventable illness. And we are seeing outbreaks of this in several parts of the world. And of course, even here in Canada, Newfoundland currently having an outbreak. Southern Alberta had a big outbreak in the summer. UK is having a large outbreak. And yes, this is a vaccine preventable illness. Whenever we see waning vaccine rates, we will see the reemergence of vaccine preventable illnesses. We're seeing a massive global rise of measles. Now we're seeing pertussis. This is not surprising, unfortunately. This is not surprising, and this just means that we really need to double down our efforts from a public health standpoint, from a clinical standpoint, in ensuring that everyone is up to date on their vaccines, because these can do tremendous damage. This is not a benign illness. This is a horrible cough, and it can cause significant morbidity and even mortality, and it's totally preventable.
Interesting. Okay, well, speaking of vaccines, Dr. Bogoch, I know there's some sort of interesting data coming out of Nordic countries right now when it comes to a COVID booster shot and hospitalizations there as well. What does that show? And I suppose more importantly for us, how could it apply here?
Yeah, there's a really good study. It's a preprint, so it hasn't yet been peer reviewed, but it's certainly coming through the pipeline, and some excellent data from Denmark, Finland, and Sweden. And it just showed the utility of that updated booster vaccine, that XBB 1.5 booster vaccine that we rolled out in Canada. And looking at this Nordic data, when they gave that vaccine, and they looked at people over the age of 65 and people over the age of 75, it did exactly what it was supposed to do. It did a remarkable job in reducing the risk of hospitalizations. It did a remarkable job in reducing the risk of death, especially in the most vulnerable groups. And not only did it work right away, it also had lasting impact about over 12 weeks after the time of vaccination. Fantastic stuff. We're going to have a vaccine program that's going to roll out in the fall. I know that seems like 100 years away, but you have to start preparing for it early. And I think when we reach that point in time, people who are at greatest risk for severe COVID-19 should certainly be going out and getting those booster vaccines and when they're available.
Yeah, and let's pick up on that, because we know sort of during the spring, summer months, when people spend more time outside, certainly COVID rates are down, and they are, of course, way down from where we were, of course, during the peak of the pandemic, et cetera. But the vaccine or booster rates here certainly have been dropping. I think that's almost inarguable. But do you think there needs to be, and I think you kind of hinted at it there, maybe a bit of a renewed push to get those people, especially the more vulnerable, 65, other health conditions, when the fall arrives, to get people really thinking about, hey, COVID's still circulating, you need to protect yourself?
Yeah, and you really want to double down your efforts on the most vulnerable. So that, of course, means good communication, but also excellent community engagement, making sure we're having these conversations in an age-appropriate, language-appropriate, culturally appropriate manner. We have, there's 41 million of us, and it's important to speak to everybody, especially those who are at greatest risk. And then, of course, we know many people who are at greatest risk have various disabilities. There might be mobility disabilities, other disabilities. So it's important that we bring the vaccine to the people rather than bringing people to the vaccine. There's sometimes in certain public health units, there's home-based vaccine delivery programs. There's pop-up centers. There's definitely mechanisms that we can use to really increase the rates of vaccinations, especially in those who are most vulnerable. It'll save lives. It'll help alleviate the capacity issues in our healthcare system. And it'll go a long way. It'll do a lot of good.
Okay, well, that is good to hear. We always appreciate you making the time for us, Dr. Bogoch. We'll talk to you again next week here on CP24 Breakfast. Have a good one.